Well, during the pandemic, there's been lots of talk about mental health. And I just read something that mental health should be everyone's problem, not just the people who have raised their hand and say, yes, I'm dealing with this. I'm so excited to welcome to our show today former U.S. Representative Patrick Kennedy from Rhode Island, plus Paul Giunfredo, who have both made it their mission to help the stigma, but talk about the funding and what needs to happen to help everybody when it comes to this mental health arena. Gentlemen, good morning. How are the both of you?
Good, Natalie. Nice to be with you.
Doing
Well,
well.
Well, let's go ahead and dive in here. You know, the mental health crisis. We have heard about that during the pandemic, but of course, so much attention has been played to COVID-19. Why is it important for us to have these conversations right now and really stress that as Americans, we all need to look at mental health? Paul, we'll go ahead and start with you.
Sure. Well, there's been a mental health pandemic, frankly, the same time that we've had the COVID pandemic. The prevalence of mental illness has increased so dramatically over the course of the last year that about 50% of us would have had a diagnosable depression or anxiety condition. So this is everybody's issue. And since mental health is tied to overall health, it's the issue for the entire health universe to be dealing with in the coming year.
I want to go ahead and talk now. The federal government did release funds in one of the stimulus packages to be able to treat mental health. Patrick, I want to get your thoughts on this one. How do you think that those funds are going to be best utilized to make sure we're fighting this problem at the core and where these funds need to be allocated?
Thanks, Natalie. What we really need is just to embed reimbursement for mental health conditions of mental illness and addiction into our insurance system and reimburse for those conditions like we would diabetes or cardiovascular disease or asthma. We really need to incorporate mental health into healthcare. It has too long been marginalized on the outskirts of healthcare and left out of healthcare altogether. That has to change. And as Paul just mentioned, you can't be healthy in any other way if you're not mentally sound and able to live life coping with the stresses that life brings. And of course, this is such an unusual time in terms of the amount of stress, dislocation, and trauma that people are suffering from. So it really, I think, means that we have to move quickly to put in place a system that has not been in place. And this is our moment to finally do so.
You know, it's interesting. I was able to read that, you know, you think of sometimes different economic classes sometimes inhibit people from getting that healthcare treatment. It's interesting to see that mental health care falls in line with this. What do we need to do to change that to make sure all communities, all people feel that they have access to the right help when it comes to mental health?
Well, I think we need to have a unified vision around mental health that works for everybody, that starts with prevention, early identification, moves to crisis services, and supports people culturally and economically where they are and with what resources we can bring to bear. That's been central to this unified vision that 14 organizations, including mine and Patrick's, put together and that 50 organizations now have endorsed about saying, this is how our system should look. It's not the way it's looked historically. But if we treat it from soup to nuts, I think that we begin to create the kinds of solutions that will work for people of all races, all ethnicities, and all cultural groups, because we failed at that to date.
Along the same lines, Paul, I want to get your thoughts on this one. It seems to me that so many times people are jumping for telemedicine and are talking to their doctors over the computer. Has that at all been changed or altered with mental health? Because I know the resources are still out there that you can get help in this arena as well through a telemedicine, kind of what we're doing today, right?
Yeah, it's helped some. I think, you know, but last spring was the first time that Medicare agreed to let people do therapeutic calls over the, telephone line. So we still have a ways to go, but telehealth, telebehavioral health are tools that can help spread the resources that we have more broadly. But we need a lot more certified peer specialists. We need a lot more allied professionals. We need a lot more people of color providing services to other people of color. And so telehealth will come a ways toward doing that, but it's not going to get us all the way there.
Well, we only have a few seconds left. And Patrick, I just want to get your thoughts. Of course, we want to send people to the right information, which we've got a website at the bottom of our screen. What note do you want to pass on as we wrap up our interview today?
You know, the United States military, which has many operational commands in Florida and your area in Tampa, puts a premium on ensuring that our fighting men and women get the best mental health care in the world, because they know it's essential to the operational demands of our military today. Why don't we look at that and say, doesn't it make sense to have the rest of us look at mental health as part of an essential capacity for all of us to achieve our best selves, to be able to manage life optimally, to minimize the self-destructive actions that often take over when we go down the road of addiction and mental illness. So I think it's so important to all of us and to our kids. We need to build this system now, and we need people out there to demand that we build this system now.
Well, gentlemen, thank you for the work that you're doing and helping spread this important message. We appreciate the both of you today. Take care, okay, and be well.